Hi, my name is Johnny Goodmanson. I'm the Director of Programming for Revelation Wellness, and today we're going to talk about low back pain. You have two key bones in your low back that cause a lot of low back pain issues. You have your sacrum. It's a triangle-shaped bone that sits right here at the base of your low back. It sits against your fifth lumbar vertebrae. So these are your lumbar vertebrae right here. They don't have a lot of movement allowed in. They're really there for stability. But if you, like me, have had babies or all of your life is in front of you, like driving, computers, things like that, we tend to stand in an exaggerated lumbar curve. You have a normal, natural, healthy lumbar curve. We tend to stand in a hyper lordotic curve. So I'm exaggerating this. I'm going to tuck in my shirt just a little bit. I'm exaggerating. I'm creating this tension, and I'm just kind of getting lazy and letting the contents of my pelvis is Latin for bowl. I'm kind of letting the contents spill forward, locking out my knees. And then what that does is it takes that fifth lumbar vertebrae against the sacrum and compresses it. Well, then if I take that into my movement and I, let's say, do a squat and I push my bottom back, I let my body spill forward, and then I lean forward and do a squat inappropriately, I'm just placing more pressure there. So what do I do to help stop that so that I have pain-free movement? Well, we all hear about the core. The core is the solution, right? And it really is. You have this muscle across your abdomen called the transverse abdominis. It's like a belt. You also have these three sheets of muscles called the obliques. They kind of move in one direction, they interlace and move in another direction, and then they move up and down. And together, those brace your spine. Our hip flexors, what allow us to kind of lift our legs and move forward in our body, are really powerful movers of that sacrum and tailbone. And so what we want to do is we want to keep that engaged. It's almost like someone's going to punch you in the stomach. That's what you're doing. Is it's not a sucking in motion. That's where it can get confused, where we, ladies, right? Like we're used to this. That's not embracing or engaging your core. Engaging your core, it's more so if someone was going to punch you, you would soften your tailbone down towards the ground, and then you would take these bottom ribs and you would draw them in and together. And you would brace if someone were going to do that. So that's called an anterior tilt. If you carried human beings in your belly, or if you have a job where you stand all day, it can get really easy to kind of just start to soften into that letting go motion in our abdomen. That can also cause digestive issues. That can also cause menstrual issues, because optimally, when we're aligned, all of our organs can talk to our spine, or more so our spine can talk to our organs, and then they're functioning optimally. And that's what we really want. Taking that into movement is really important, because if I already have that dysfunction and I don't correct that dysfunction, I just start to take it into my movement, I just kind of put more pressure on that area. So I want to find a neutral in my movement first. What is that neutral? Well, it's softening your tail down, engaging in this core musculature, taking those ribs in and up, and then from here, I'm going to engage in whatever movement I'm choosing to do for my workouts. We have a lot of those different videos on how to use form and function for those things, but we want to take that neutral and then move from that neutral. I'd love to hear what you have to say about this video. Comment, let us know. And if you want more training and free workouts, head to revelationwellness.org. We'll see you next time.